Welcome to the Oral Health Education Series, Module 5, Oral Diseases and Conditions, Part 2. Dr. Brecky again, here with Ready, Set, Smile, to continue talking about some of the most commonly experienced diseases in the oral health sphere. So, what have we learned thus far? Well, many oral diseases exist, which play a very important role in one's overall health. In fact, there are many common risk factors that oral diseases share with each other and with other common diseases such as heart disease, diabetes, etc. So to review what we talked about in our last part 1 of this module, first we reviewed dental caries, which is also known as tooth decay. It's one of the most common oral diseases experienced worldwide. Second, we discussed periodontal disease, which is an umbrella term for many different diseases affecting the gums and supporting structures of the teeth, the gums, tissues, and the bone. The more common of these includes gingivitis, and further down the spectrum to periodontitis, which actually comprise the #1 cause of tooth loss. Next, we talked about xerostomia, which means dry mouth. Dry mouth is often experienced by older adults, those taking many medications, those with other diseases like diabetes, or those with a history of head or neck radiation. It can play a very, very negative role in one's overall quality of life. And lastly, we talked about tobacco use and abuse, which is a very, very common problem and leads to 1 in 5 deaths in the United States today. So, today, part 2, we're going to talk about oral cancer, candidiasis, halitosis, bruxism and clenching, and also dental trauma. Now, just to repeat, this is not a complete list of oral diseases and conditions, but just a few of the most common ones that you might experience or you might know people who experience in your respective fields. So first, oral cancer. Oral and oropharyngeal cancers. There's over 51,000 new cases of OPC cancers in the US every year. Now, interestingly, the rate of HPV-related oral cancers has been increasing. We'll get into that in a moment. The 5-year survival rate for oral cancer is less than 65%. It is a very deadly form of cancer. There were over 10,000 deaths in 2018 alone. And just to reiterate, alcohol and tobacco use actually have a multiplicative effect on the risk of developing oral cancer. So what are other risk factors for oral cancer? Well, sex, age, smoking status, alcohol use, drug use, or a history of drug use, risky sexual behaviors, race, and also mental health problems. Now, this also includes socioeconomic status, education level, etc. Human papillomavirus is a sexually transmitted infection. HPV has caused diagnosis of oral pharyngeal cancers to rise in recent years. Now, luckily, HPV-positive cancers actually have a more favorable prognosis with treatments. However, HPV-positive cancers have they've shifted the demographic of patients with oral cancer into a younger and also into more female populations. Now, vaccine campaigns have helped to reduce the incidence significantly, so vaccination is the key to prevention. Now, the vaccine, Gardasil, has been recently extended to boys, so girls and boys of adolescent age, before they begin their first sexual experiences. What are the treatments for oral cancer? Well, there's radiation treatments, there's excision of the cancerous lesions or surgeries, and there's chemotherapy agents. There's also combinations of the above options. Again, the prognosis for oral cancer is not great. It's a very deadly cancer, so prevention is key. What are some considerations for head and neck cancer patients? Well, head and neck cancer patients are at increased risk for side effects related to their treatments, which can be very severe, life-threatening, and they can greatly reduce the quality of life. So special considerations, especially in a dental setting, include preventive extractions, removing teeth prior to radiation treatment, fluoride treatments and home trays for those who do have teeth before and after treatment, hyperbaric oxygen treatments, diet changes to prevent irritation, treatments for dry mouth, which can be very severe after treatments for oral cancer, and palliative treatments. Again, prevention is key. So let's talk about candidiasis, also known as a yeast infection. So what is oral candidiasis? Oral candidiasis, also known as oral thrush, is a yeast or fungal infection. Candida albicans, a fungus, is actually naturally living in our mouths already. In cases of oral candidiasis or oral thrush, this fungus overgrows. This occurs in 5 to 7% of babies at some point, or in 20% of patients with cancer. It's also more common in older adults and those with weakened immune systems, and it's a very, very common side effect of immunosuppressants like corticosteroids in normal inhalers, treatments for asthma. So what are some signs and symptoms of oral candidiasis? Well, there's white bumps or patches on the tongue or cheeks, pain, a bad taste in the mouth, angular colitis, which is the dry, crackled corners of the mouth, difficulty swallowing, or difficulty feeding if you're talking about infants, and lastly, bleeding. Some risk factors for oral thrush include age. Like I said, young babies and also much older adults are prone to developing thrush. Patients with poor immune function, those with steroid use, especially, like I said, those inhaled corticosteroids, those with poor oral hygiene, those with dentures and denture use, especially not taking them out at night or not cleaning them properly, smoking, HIV and AIDS, or taking other medications that might put them at risk for oral thrush, among others. And what are some treatments for oral thrush? Well, antifungals are number one. It's really important that this is treated because it is an infection and it can worsen. Improving systemic health so that your body can fight this infection. Properly cleaning dentures or any sort of partial provided by a dentist. And taking probiotics like yogurt, which will colonize the oral environment with healthy, good bacteria. Rinsing with salt water is another alternative, and improving overall oral hygiene. So what is halitosis? As you can see, ick. It's just another term for bad breath. Halitosis is a form of chronic bad breath that negatively affects one's quality of life. It can affect one's own sense of smell or even taste. And it can negatively impact on one's personal relationships, communication with others, and even perception of themselves. So it sometimes can reveal an underlying untreated medical issue. What are some risk factors for halitosis? Well, first and foremost, genetics, age, certainly tobacco or alcohol use, poor oral hygiene, poor diet or malnutrition, xerostomia or dry mouth can lead to halitosis. Postnasal drip or infections of the tonsils in the throat, systemic diseases such as diabetes. Poorly cared for dentures is also will put one at risk for halitosis because they can collect gunk just as well as our teeth can. And choosing aromatic foods like the tuna can right there. Or garlic. So what are some treatments? First, of course, practicing good oral hygiene. Use mouth rinses if you can. Make sure that you're brushing or scraping the tongue. Chewing sugar-free gum is also an option, especially between meals. And drinking adequate liquids to make sure you have great salivary flow. Avoiding tobacco or marijuana or even stinky foods like garlic, tuna, etc. Treating the underlying medical problem. This can be things like GERD or diabetes. Visit your dentist regularly because the key here is prevention. As with, I think we're realizing a theme here, as with all other medical, oral health conditions and problems we've talked about. Bruxism and clenching. What the heck does that mean? Well, many people have oral habits which can be damaging to the dentition. Bruxism means grinding of the teeth, bruxing. Clenching means strongly biting down. And these are both habits, and they can both very, very much damage your dentition. So bruxism and clenching. It's a common daytime or nighttime habit, and almost all people, children and adults, clench or grind their teeth at some point during their lives. Well, what happens if you clench or if you brux? Damaged teeth, such as cracks, fractures, something called abfraction or attrition, pain, both in your teeth and in your face. Some of the more common muscles of clenching is the muscle on the temples. So it can actually be all associated with the teeth, the jaw, and myofascial pain. Sensitivity in your teeth, an altered bite or occlusion, or damage to the TMJ or jaw joint. Very important to take care of that one because we use it so often. So what are some risk factors for clenching and bruxism? Well, malocclusion, which means incorrect or bad bite, a crooked bite. Those can increase the risk of clenching or bruxism. Medications can actually induce clenching or bruxism, such as some antidepressants. Stress and anxiety are probably the biggest risk factors for clenching and for grinding. Psychological issues and mental health problems also increase the risk of these issues, and other oral habits, existing oral conditions, and age or gender. These are all risk factors. So some treatments for bruxism and clenching. Avoiding triggers is key, and that might mean stress. Behavioral therapy, physical therapy, considering something like a NIGHTGUARD or a occlusal guard, which was depicted in the lower left photo there. Forming a new habit, such as attempting to chew gum, as long as it doesn't affect the TMJ. Exercise, avoiding alcohol, caffeine, or other drugs, or mindfulness and stress management. Consider something like yoga. Lastly, medications. Yes, some medications can induce bruxism and clenching, and some are available to help treat things like that. However, speak to your physician because clenching or bruxism would have to be very, very severe to take a new medication to prevent it. So what are some treatments for bruxism and clenching? Well, 30 to 40 million adults and children suffer from clenching and grinding. And again, I'll reiterate this point. The best treatment is prevention. And what does that mean? Reducing stress. As you can see by this photo here, we don't recommend chewing on pencils. So that brings us to our next condition, which is dental trauma. Dental trauma. 1/3 of children have experienced trauma to their primary dentition. Even more importantly, 1/5 of adolescents have experienced trauma to their permanent dentition. That is 20% of the population, and those are teeth that they will keep for the rest of their lives. Dental trauma mostly occurs in front or anterior teeth, secondary to falls or sports in most cases, but in others it can mean abuse and trauma. So what types of trauma actually exist? There's a lot of them. Concussion, hitting a tooth, subluxation, luxation, intrusion, a tooth moving inwards, extrusion, a tooth coming outwards a little bit, fracture, avulsion, complete dislodgement of a tooth, Feel free to pause this slide if you'd like to learn more about these terms, but this is a little too much detail for what we need for our purposes. But there are a lot of different ways you can injure or traumatize your tooth. So what are some risk factors for trauma? Well, genetics, age, physical activities like sports, alcohol use, anatomy, malocclusion, socioeconomic status, oral habits, mental health problems. And I should also note here, unsafe home environments. So what are some treatments for dental trauma? Well, primary teeth are not as concerning for urgent treatment. If a tooth has avulsed or completely dislodged, if it is a permanent tooth, and only if it's a permanent tooth, less than 1 hour of time, you can place it in a milky solution, or if clean, re-implant right away. Visit the dentist ASAP. If it's been over an hour that a permanent tooth is dislodged, do not save the tooth at this point, but visit a dentist. The best treatment is prevention. So what are some tips for prevention? Choosing healthy lifestyles, eating a healthy, well-rounded diet, visiting your dentist regularly, brushing your teeth twice daily, and your gums and your tongue. Learn about your oral health and take charge of your overall health. Both very, very important in taking care of our teeth. Oral diseases share many risk factors with many other systemic or whole body problems. And oral diseases can be detrimental to overall health and quality of life. So it's important to remember, many oral diseases affect overall health, and many oral diseases stem from problems with your overall or systemic health. One of the most important takeaways of all of these oral diseases and conditions that we've talked about is that prevention is essential. Just remember, the greatest wealth is health. Thank you to our sponsors. For questions regarding this module, please contact BreckyHuddleston@gmail.com. And we'll see ya with Ready, Set, Smile next time. Thank you.